Nurses, medical assistants, and technicians at Michigan Medicine play a critical role in the care of transgender patients. Let's look at how nurses, medical assistants, and techs across the health system can provide excellent care to all patients regardless of gender. We will talk about 3 opportunities for nurses, medical assistants, and techs to ensure the care at Michigan Medicine is gender affirming. Use of names and pronouns, guidance for taking a history, and bystander responsibilities. We'll start by talking about names and pronouns.
James Lee? Is there a James Lee? Mr. James Lee for an appointment with Dr. Smith?
The name on my insurance card is James Lee, but I go by Mauve, not James.
Oh, sorry, Mauve, for using the wrong name. Please come with me and we can try to get that updated in the computer system.
Thank you.
Misgendering, or addressing people using the wrong gendered language, can be avoided by not using gendered terms like Miss, Mr., Sir, etc., and by asking people what they would like to be called. Because your assumptions about someone's gender may be incorrect, greet people kindly without using gender markers. Addressing patients in a way that is congruent with who they are shows patients that we respect them and their identities. For patients who are transgender, using the correct name and pronouns are of particular importance. Identifying transgender individuals by the wrong name in waiting rooms and public spaces can out or publicly expose the person and can lead to unsafe situations. If you make a mistake or misgender someone, apologize. Apologies should typically be sincere, short, and discreet. There are a few ways to address the issue of calling patients from the waiting room. Some clinics use a number system where patients are called using a number. Other clinics have their clerical staff ask patients what name they would like used at check-in. In parts of the health system where these methods are not used, we suggest using a patient's last name without a gender marker. Let's try that last interaction again with a different approach.
Last name Lee? Hi, come on back.
Thank you.
Hi, my name's Jess. I work with Dr. Smith. How do you prefer to be called?
I prefer Mauve.
Oh, nice to meet you. I can get that updated in the computer system. Can you verify your date of birth?
Yes, my birth date is 4/4/1980.
Okay, great, Mauve. Let's go ahead and get your vitals.
When you are meeting a patient for the first time and do not know what they prefer to be called, the best practice is to ask them how they would like to be addressed. We all know individuals who were, for example, named Catherine at birth, but use and strongly identify with the name Kate or Katie, and not as Catherine. Regardless of gender, the name a patient uses can be documented in my chart as their preferred name. Though this is labeled preferred name in my chart, it is better thought of as simply the patient's name. If a patient has changed their legal name, they can be referred to clerical and registration staff who can change one's legal name in the medical record system with the appropriate documentation. Let's look at another scenario.
It's Jan, one of the nurses. May I come in?
Yes,
I'm Jan. What do you like to be called?
I'm Tom.
Nice to meet you.
You too.
Is Terrence the correct last name?
Yes, it is.
It looks like we might have a different first name listed for you on your chart. Can you tell me your date of birth just to verify that I have the correct chart?
Sure, it's April 4th, 1980, and I don't go by my legal name.
I'd be happy to have the name Tom added to your chart as the name you use if you'd like.
Yes, please. And if we can also have my gender identity updated as male and that I use he, him, his pronouns, that would be great.
Absolutely. I can change your gender identity and pronouns in my chart. It's important for you to know that in some areas of the health system, staff will see your name as it appears on your insurance records. So some printed items you may receive from the hospital will reflect the name that you have on your insurance card.
Okay.
Please know that we're working to correct this issue.
Okay.
And then it's also important for you to know that by changing the name you use and pronouns in the system, that'll change the name and pronouns that appear on printed communications from the hospital, such as letters to your home.
I see. Okay.
Next, we'll talk about tips for taking a medical history.
I'm hoping Dr. Smith will be able to take a look at a rash that's developed on my right breast just in the last few days.
I'm sure Dr. Smith will be happy to take a look at your rash. Let's review your medical history and your medications first so I can make sure I have all the relevant information on file for Dr. Smith.
Okay. I'm actually in pretty good health.
Okay. I just have seasonal allergies listed for your medical history and chondroplasty listed for surgery.
Yes.
And for medications, I have estrogen and spironolactone listed. Any new medications or recent dose changes?
Nope, that's it.
I used to have one other question. Have you noticed since you started taking the estrogen that you're feeling more emotional? I've always wondered what the transition from testosterone to estrogen feels like.
Look, I'd prefer that we focus on the rash.
Regardless of one's intentions, asking questions about one's gender transition or genitals when not directly related to their concern is inappropriate. When taking a history, focus on what is relevant. If a question about someone's transition, anatomy, or experience being transgender isn't directly relevant to their medical care, don't ask it. Let's look at another patient interaction.
So the order says that you're here for a pelvic ultrasound. Is that correct?
Yeah, that's correct. I'm thinking about trying to get pregnant, but my doctor said they couldn't find the string to my IUD.
Okay. All right. Okay, well, I guess we just need to do an ultrasound. I'm just going to put this probe on your belly and we'll see if we can find your IUD. Okay. I'll just have you lay back here. And then if you could sort of lift your shirt up, and then I'm just going to put this on your belly here. I've never done an exam quite like this before.
In the last scene, the person running the ultrasound used body language, intonation, and comments that could easily make a patient feel othered or judged. Small changes in body language, including eye contact and awkwardness with physical exams, send strong signals to patients about whether they are safe and accepted. Let's look at that scenario again with a few subtle changes.
So it looks like the order says that you're here for a pelvic ultrasound. Is that correct?
Yes, I'm thinking about trying to get pregnant, but I need to get my IUD out, and my doctor couldn't find the strings.
Okay. Well, we're going to do an ultrasound today. We'll use a probe on your abdomen to see if we can figure out where your IUD is.
Okay.
Okay. So I'll just have you kick your feet up here and go ahead and lay back for me. And then if you could lift your shirt up a little bit, this might be cold, okay? Okay, a little bit of pressure. All right.
We'll end by talking about bystander responsibilities. The patient we met earlier, Mauve, got her rash evaluated, but unfortunately got in a terrible accident on the way home and is now in the emergency department going through a trauma evaluation. Mauve is seriously injured. In this scene, emergency department staff are talking about next steps in her care.
We're going to need to keep Mauve lying flat, and we're going to need to place a Foley. So Megan, can you place that Foley, please?
Seriously? On this lady, man? Who knows what's down there?
Right? Better you than me.
This is inappropriate language and is not acceptable. The University of Michigan has a comprehensive non-discrimination policy and does not discriminate against individuals on the basis of gender identity, gender expression, or any other legally protected basis. If you are a bystander and overhear this type of language, it's your job as a team member, regardless of role, to speak up. Discriminatory and derogatory speech and behaviors should be reported to your supervisor and are grounds for disciplinary action. If you do not feel comfortable talking to your supervisor, please contact the Patient Civil Rights Coordinator. Let's look at that scene again, this time with bystander intervention.
So we're going to need to keep Mauve lying flat and to place a Foley. Megan, can you get the Foley placed, please?
Seriously? On this lady, man? Who knows what's down there?
Megan, the language you just used is completely unacceptable and inappropriate. It violates Michigan's non-discrimination policy. Maeve's our patient, she deserves our respect, and I'm going to need to talk to her supervisor about this. Please leave. I'll take care of Maeve's Foley.
Beyond individual patient encounters, you play a key role in setting the tone in clinic and departments about how gender-affirming care and gender non-conforming patients are discussed. Your work is critical in helping transgender patients feel safe and welcome in our health system. To recap, in order to ensure we provide excellent care to all people regardless of gender, avoid assumptions about gendered language. Apologize if you accidentally misgender someone. Call people by the names they request to be called. Reflect this in your charting and update demographic information in MyChart as needed. Recognize the difference between sex assigned at birth and gender identity and document accordingly in MyChart. Questions about one's transition or genitals should only be asked when medically necessary, not simply out of curiosity. Mirror patient language during physical exams. Ensure that your body language and words show that you are non-judgmental and accepting. And speak up if you hear a colleague acting or speaking in a discriminatory or derogatory way. For those interested in learning more about gender-affirming care, resources including the World Professional Association for Transgender Health and the publicly available guidelines for the primary and gender-affirming care of transgender and gender non-binary people on the UCSF Center of Excellence for Transgender Health homepage may be of use.